If you are reading this article, you are probably over the age of 65 or eligible for Medicare benefits, or perhaps you have concerns about medical expenses. However, before you worry, are you fully aware of the free preventive health services offered by Medicare? Many people are unaware of these benefits, so today we have some exciting news to share with you. Medicare is not just a program that helps pay for hospital bills. It is actually a comprehensive health management system designed to help you stay healthy and prevent illness before you get sick. As of 2025, Medicare provides free flu, pneumonia, and COVID-19 vaccines, as well as various cancer screenings, diabetes tests, cholesterol tests, and health counseling to Americans aged 65 and older. You may have looked at your medical bills and wondered, why is this so expensive? However, by taking full advantage of Medicare's preventive services, you can catch serious illnesses early, potentially saving you thousands of dollars in medical costs. For example, regular cancer screenings can help detect the disease early, potentially saving you hundreds of thousands of dollars in treatment costs. Let's start with vaccine benefits. Medicare Part B provides 4 core vaccines at no cost. The flu vaccine is available from August to July of the following year, and the pneumonia vaccine can be administered up to twice in a lifetime. Additionally, the updated COVID-19 vaccine for the 2024 to 2025 season is also free, with up to 3 doses available for those aged 65 and older or with weakened immune systems. If you are at high risk for hepatitis B, the hepatitis B vaccine is also free. These vaccines are available not only at hospitals, but also at local pharmacies, health centers, and even large supermarket pharmacies such as Walmart. Starting in 2025, a home visit vaccination service will also be available for those who have difficulty leaving their homes. Isn't it convenient to be able to get vaccinated at home? But that's not all. The health screening services provided by Medicare are truly impressive. Let's start with cardiovascular disease screenings. You can receive free cholesterol, triglyceride, and lipid tests every 5 years. These tests help identify the risk of heart disease, stroke, and heart attack. If you are diagnosed with high cholesterol, you can continue to receive free blood tests to monitor the effectiveness of your treatment. Comprehensive cancer screenings are also covered. Mammograms for breast cancer screening are free annually, and colon cancer screenings are available every 1 to 10 years depending on the testing method. Cervical cancer screenings and pelvic exams are also provided regularly at no cost. For lung cancer screenings, low-dose CT scans are available once a year at no cost for those with a history of smoking. Of particular note are diabetes-related services. Starting in 2024, Medicare has significantly expanded diabetes screening. A1C tests are now available free of charge, which is a convenient test that can be taken without fasting. Individuals with a history of high blood pressure, high cholesterol, high blood sugar, or obesity can receive diabetes screening free of charge up to twice a year. Even more impressive is the Medicare Diabetes Prevention Program. If you are diagnosed with prediabetes, you can participate in 22 group sessions over the course of a year at no cost. This program has been proven to reduce the risk of developing diabetes by over 70% through diet, exercise, and behavioral changes. During the first 6 months, participants attend 16 core sessions weekly, followed by 6 monthly follow-up sessions over the next 6 months. Until December 2027, the program can also be accessed virtually, allowing participants to participate from the comfort of their own homes. One of the biggest advantages of this program is that no doctor's referral is required. It is offered through a variety of organizations, including hospitals, community centers, doctors' offices, federally qualified health centers, YMCAs, and churches, making it highly accessible. Program providers can receive up to $768 per participant from Medicare, providing sufficient incentive to deliver high-quality services. There are also various places where you can receive Medicare preventive services. The most common place is your primary care provider's office, but local pharmacies also provide most vaccines and basic screenings. You can receive services at large pharmacy chains such as CVS, Walgreens, and Rite Aid, as well as at pharmacies in large supermarkets such as Walmart and Costco. When receiving services at a pharmacy, it is recommended to call ahead to confirm the availability of the required vaccine and the cost. To receive Medicare benefits, the provider must accept Medicare, so this should also be confirmed in advance. While most vaccines are covered by insurance, prices may vary by pharmacy, so it is wise to compare prices at multiple locations. Federally funded health clinics are also excellent options. They are available even without health insurance, and discounted rates may apply based on income. You can easily find a nearby clinic using the Health Center Finder. State and local health departments also provide information on vaccination locations and free or low-cost vaccine options. Senior centers are also an important resource not to overlook. Many senior centers host regular health screenings and offer health education programs. These places provide opportunities to share health information with peers, encourage one another, and build a community that supports healthy habits. In 2025, there were several important changes to Medicare. The most notable change is the expansion of mental health services. Marriage and family therapists, mental health counselors, and addiction counselors are now eligible to register as Medicare providers, greatly improving access to behavioral health services. Over 400,000 behavioral health clinicians are now eligible to participate in Medicare, significantly increasing options for mental health treatment. Telemedicine services, which were expanded during the COVID-19 pandemic, have been permanently expanded in the behavioral health field. This is particularly beneficial for those living in rural areas, as they can now receive mental health counseling from the comfort of their own homes. If you have a Medicare Advantage plan, you can enjoy even more benefits. Starting in 2025, plans offering vision 99%, hearing 97%, and dental 97% coverage will be widely available. Additionally, special benefits for people with chronic conditions have been strengthened, providing access to services that can make a real difference in maintaining your health. However, to make the most of these great benefits, it's important to know a few practical tips. First, create an account on Medicare.gov and check your preventive services calendar. This allows you to view your screening schedule for the next 2 years, helping you plan ahead and avoid missing important appointments. Regular communication with your healthcare provider is also very important. During your annual wellness visit, be honest about your health status and risk factors. Your doctor will recommend preventive services that are right for you. This annual checkup is also one of the services provided free of charge by Medicare. It is also important to keep track of your vaccination schedule. You should get a flu shot every year, up to 2 pneumonia shots in your lifetime, and regular updates of the COVID-19 vaccine. Use your smartphone calendar app or ask your healthcare provider to send you reminders. Getting multiple vaccines at the same time is safe and efficient. You can get the flu, COVID-19, and RSV vaccines on the same day, which reduces the number of visits to the doctor. Talk to your healthcare provider to develop the most efficient vaccination schedule for you. It is also important to carefully manage your health checkup results. Keep your checkup results in a file and follow up with your healthcare provider if you have any concerns. Early detection is the most reliable way to increase the success rate of treatment and save money. It is also a good strategy to take advantage of local resources. You can easily find a nearby vaccination site by visiting the vaccines.gov website. Call 211 to get information about essential community services in your area. You can also find information about home visit services for people with limited mobility at these locations. There are various support services available, especially for people who do not have transportation or have limited mobility. You can search for services by zip code through the Aging Network, 1-800-677-1116, or the Elder Care Locator. There is also a dial hotline for people with disabilities, 1-888-677-1199, and a dedicated hotline for Medicare beneficiaries, 1-800-633-4227. To make the most of Medicare's preventive services, you need to take the initiative. Ask your healthcare provider about all the preventive services you are eligible for. The best way to find out is to ask directly, are there any free screenings or vaccines I can get? Share this information with your family members. Many people who are new to Medicare are unaware of these benefits. By learning about them and sharing this information with your family, you can help everyone stay healthy. Medicare's preventive services are more than just a way to save on medical costs. They are an investment in your quality of life and your ability to live longer, healthier years. Health is essential to living a vibrant and meaningful life after age 65. Finally, remember that these services are your right. If you are paying Medicare premiums, you are fully eligible for these preventive services. Don't hesitate. Take advantage of them actively. As of 2025, Medicare preventive services are more comprehensive and accessible than ever before. From new mental health services to expanded diabetes prevention programs, all the tools you need to protect your health are available. Now it's your turn to take action. Visit Medicare.gov today to check your preventive services schedule. Then call your primary care provider to schedule your next checkup. Start taking steps toward a healthier future today. That's all for today. Thank you very much for watching until the end. We will continue to bring you more useful information on how to maintain happiness in your golden years. Please subscribe and like our channel to show your support. Thank you.